emergencies, there are a couple of things that are important. First of all, you do not want your trailer to be the emergency. I have seen way too many cases where people do not check their trailers before they take off. They load horses, you've got rotten floorboards, horse steps through a floorboard, you're dragging at 60 miles, it's not pretty, okay? Please, 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 before you take off to go any direction, once a year, twice a year, whatever the case may be, really take off those mats, check to see what's going on underneath, make sure that your trailer is sound, not just roadworthy based on the tires, but that the inside is also going to be sound and healthy and capable of holding animals. What type of trailer you use, you can have horses that will load onto any trailer, you can have horses that will only load onto one trailer, you can have horses that have had bad experiences. Don't let the time you have an emergency be the first time you have to load a horse. Even if it takes time, even if you have to take it to somebody to train that horse to load, make sure that the first time you're loading a horse is not during an emergency. Obviously, if you're dealing with a foal, that's very different. Most of us can pick it up and toss it in there and our mare's gonna fall, okay? But if we're talking about standard size horse, please, please, please work on that ahead of time. Make sure that your horse knows how to load. Make sure that your horse knows how to unload. Make sure that if this horse does have any issues, you are aware what the issues are. This horse doesn't like to load in a slant. This horse doesn't like a two-horse. This horse, and some horses do. They suffer from claustrophobia. Some horses don't load alone. Some horses are kickers. You want to know what is going on before you even load that horse. Second thing, when you are going on any sort of a trail ride or you're going to be long distance, it's a good idea to have some sort of an emergency kit. And it doesn't have to be a huge emergency kit. All of these different things that you're going to buy, you can either buy at a vet supply store, you can buy online. Many of them are human related. It's just a matter of having things ready to go. The easiest thing that you guys can do is buy yourself some sort of either a tackle box if you like to fish, or you can buy yourself a nice toolbox. You can buy yourselves a tub like this. You want to have something that's going to be relatively sturdy, and you want to have something that's probably going to be plastic in case it gets wet, in case it dries. And again, you want to make sure that the supplies that you keep in there are supplies that are going to be protected. A lot of the stuff, bandaging materials, potentially antiseptic solutions, ointments, stuff like that, you don't have to really worry about expiration date, okay? From my personal experience, I'm a lot more comfortable if we fudge a little bit on expiration dates on stuff that's going to be used topically. That doesn't worry me. So it expired in 2022. Well, it's 2023 and it's a triple antibiotic ointment. Hasn't been opened, it hasn't been smeared all over the countryside. You're probably going to be okay to use it. Second option, if you're dealing with anything that's going to be oral, you want to make sure that it's either within expiration date, or I would probably take it maybe about 6 months out from expiration date, not beyond that. And a lot of that is going to depend what conditions it's kept in. So if you have your emergency box, some sort of a toolkit, tackle box, whatever you end up using, and you keep it in a safe and protected environment, either be it the trailer, be it a tack room, be it inside your house, just make sure that you check all of your supplies. It's always a good idea to have some sort of an inventory on that, just so that you know what it is that you had in there. Somebody used supplies, you know that you've replenished them. If you haven't replenished them, then maybe it's time to look for something to replenish them with, and just kind of using common sense. If you're going out as a group, you don't all necessarily have to have the same emergency kit. So one person can have all the bandage materials, anything that deals with legs, anything that will deal with ointments. The other person can have the first aid kit that belongs to humans, in case somebody gets cut, in case somebody has an issue, in case somebody has an injury. Somebody else can have medication. And when it comes to medication, I think personally it's a good idea to share if it's something that's an option for you. If you know that your horse is the one that suffers from hives every time you go out into the country and get this horse exposed to some sort of a plant, then you probably need to carry your own medications. But if it's just a scenario where you're just kind of covering all of your bases, it's okay as a group to have a medicine kit, okay? That one, if it's anything that's going to be injectable, make sure that you are comfortable giving shots. Again, an emergency is not the time to learn how to give injections, especially IV. And there's nothing wrong with giving oral medications. Again, we're talking about an emergency, which means you're going to do the best that you can possibly do. And a lot of times that's going to imply oral medications. Okay? So I did come up with a list. You guys are certainly welcome to look through it. But in general, you're going to have some sort of bandage material that'll cover the legs. So we'll go through that with Nancy's horse. But cotton roll, cotton bandage, these are going to be good things to get a hold of. Vet supply stores have them, very easy to get. Second option that you can use, which is what we're going to be using here, quilts and polos. They work fantastic. Toss them in the wash, clean them up, you're good to go next time, and they're perfectly good. okay? So you want to make sure that whatever supplies you have and they're clean. Next supply that you're probably going to be wanting to use some sort of a cotton dressing, so you can imagine that if you've got an open wound somewhere, you want something that you could potentially put on that wound in direct contact with the wound. I think we've all had a scenario where even on yourself you end up putting like a piece of tape because it's just oozing a little bit, and then trying to pull that piece of tape is not so much fun. Horses are particularly sensitive. They don't really like having things torn off their skin, especially if it's well adhered. So obviously if you've got some sort of a bandage dressing that you can use that's supposed to be non-adherent, that's likely going to be a good option for you. Other things, adhesive tape, adhesive wrap, they work absolutely fantastic. Again, you can certainly use polos, you can use any sort of a vet wrap, these are good things to use. In a pinch, always carry duct tape. Duct tape works really well. Duct tape and baling twine are your best friends. I can't emphasize so much enough how much you'll end up using. Bandage scissors. If you don't have a pair of bandage scissors, get yourself a good pair of scissors that you can use that you can exclusively leave with your bandage supplies. Why? Because they're going to start getting a little dull, they're going to start getting a little used. You don't want to make sure that somebody uses them and then they forget to put them back. So always have stuff that's destined to be in that box that you can include as part of your inventory. Hemostats, plus or minus, if we end up having any sort of a bleeder, and I think all of you have seen them, they look like little scissors, but you can apply pressure and they'll actually clamp shut. Those work great. They're not that hard to get. You can order them online, you can get them through a feed store, you can get them through old human supplies, you can get them through old veterinary supplies, and you just want to make sure that they're clean and they're functional. Steel cup or container, this is going to be something that you might potentially use if you're going to mix any sort of a solution up, either water or a little bit of betadine into your water, or you're going to put hydrogen peroxide. It's always nice to have something that's going to be made of steel, it's easy to wash, easy to clean, wipe it off, you're good to go, okay? Again, you're in the field, it's an emergency. You're not looking for sterile, you're looking for clean. There's a difference. Clean will still get you places. And again, the idea behind an emergency is you're going to cover the first bases, and then you're going to take it to somebody that will potentially either stitch it up or do whatever else needs to be done if that's where that emergency leads you. Rectal thermometer, again, there are multiple options. Mercury thermometers are great if you've got great eyesight and it's not dark and you know how to shake that little sucker down and and you remember that you popped it in there, you don't walk away and forget about it because it lands on the road and you're done, okay? I grew up playing with mercury and it was never toxic when I was a kid. I can't really say that that's the case right now. So realistically, one of the best options that you can have is just go ahead and get yourself a little rectal thermometer. You know, they've got all the ones that they have for kids. They work great. Usually they have a little light that comes on, and so you can even see them at night. Tuck it in, 6 seconds. Most horses will stand for 6 seconds. You can find out if your horse is having a fever or not having a fever. Any sort of surgical scrub works great. Okay, so it's going to be some sort of an antiseptic soap, and you can certainly use that. They're liquid soaps. Personally, and this is my personal opinion, what I would carry would be dish soap. And the reason I say dish soap is, as we all know from watching all of these commercials throughout the years, Dove is fantastic for your hands. You know, it keeps them nice and soft and supple. And the reason why they can say that is because it's got a neutral pH. So what you're looking for is something that'll wash out whatever's in that wound if you're dealing with a wound. But because it's got a neutral pH, if we've got any sort of a residue, it's not going to create more of a problem for us. Okay? And it's hard. Sometimes we just don't manage to get all of the soap out. Antiseptic soap works really good. Again, it's antiseptic. But if it ends up staying there, potentially, and your horse has a little bit of a reaction, it can be a little bit on the inflammatory side. Antiseptic wound cream is always nice to have. It works really, really well. So you can have some sort of a triple antibiotic ointment. You can have just a bacitracin. Any one of these are going to be a good option. That being said, some people are very allergic to that kind of stuff. And if you are one of those and you cannot be in contact with it, guess what? Nothing grows on Vaseline. Nothing. In my opinion, you can't even get flies to lay eggs on Vaseline because they probably just slip off and they can't. But point being, it works really well. So Vaseline is a great option for wound. Rubbing alcohol works great. Some horses are sensitive to the smell. Obviously, there's going to be that direct contact, which might sting. So it's good to have on hand, but again, sometimes you have to be conscientious and be aware that that horse might not tolerate either the smell or the feeling of it. So it's great if you're going to end up giving shots for any reason. Putting it on a wound, probably going to be the one time you do it, and that horse will never let you touch that wound again. Latex gloves, that's for your protection more than anything else. And this is one thing that even if you're keeping it inside one of your little trusty little emergency kits, check the gloves. We are in the state of New Mexico. Things dry rot like you would not believe. I work for the Livestock Board. We are an emergency providing agency in the event of large-scale emergencies. We have to check our gloves consistently. Just kind of pull one of them out, put it on, make sure that it stretches and that it's appropriate. You're going to be fine. Another option for that, nowadays it's very easy to get latex gloves. I mean, after COVID, everybody can get nitrile gloves, latex gloves, any sort of gloves work absolutely fine. If you're sensitive to any of those, kitchen gloves work great. A stethoscope, a good idea, and it's a good idea to practice listening to heart rates. That's going to be the major one that you're going to be interested in, okay? Gut motility, yes, no, that might play a role for you, but realistically, if we're dealing with an emergency, one of the things that we want that stethoscope for is to be able to listen to the heart rate. More than anything, and part of the talk that I gave you guys today is how to euthanize a horse. If you are putting a horse down, it is your responsibility to stay there and confirm the animal is dead. If you do not confirm that that animal is dead and that animal is still alive when you walk away, that is considered cruelty, okay? So it is very important, if you take the responsibility of putting an animal down, that you confirm that that animal truly is dead, okay? That's where your stethoscope comes in handy as well. Flashlight, always a good idea to have flashlight and have batteries. Make sure you check them. Most people will have them in their own emergency kit anyway. If not, it's a good idea to have them inside your equine kit, whatever you're using. Permanent marker pen, not a bad idea to have. Occasionally you might need to mark something, either on a label, on a container. If you're going to euthanize a horse and you've never done it before, you might even mark your spot on a horse. So it's not a bad idea to have a permanent marker. Make sure it works, that it is going to be appropriate for you. Little baggies, stuff like that, plus or minus depending on what it is that you use. But for the most part, all of those different supplies you're likely going to be carrying somewhere else in your truck, or you're going to have in your personal first aid kit. Ice pack or cold pack, very nice things to carry. Anything that you could potentially freeze, have on hand is going to be a good idea. So you can just keep a regular gel pack. And then in the event of emergency, if you have a possibility of putting it inside a cooler, that will always help. These are typically available for the most part, plus or minus. You can find some of these available online. You can Google them, you can look them up, you can look for different emergency procedures, and they will give you a general idea of what it is that you can do. As you gain a little more experience, you might discover that you need this over that, or you might just have one roll of tape and be okay with that, but you might need 2 rolls of that wrap, okay? In a pinch, you can always end up using your equine supplies on a person, so that's not a bad idea to have. My generic rule is if you're going to have, for example, roll cottons, you should have enough that you can wrap 2 rolls. Because if for any reason you need to do a fat wrap on one leg, you've got enough supplies that you can do a fat wrap on that one leg, okay? So that's going to be when it comes to the inventory. Those are different things that you can plan on. As far as medications go, what medications should we have? That's a little bit more of a ticklish question to have. Again, if you're going to be going for longer periods of time, or you know that you might have an issue with hives, things like that, might not be a bad idea to have some form of a steroid. Usually it's going to be some form of a dexamethasone, which is going to be a rapid-acting one, or you can end up having prednisone or prednisolone. Usually it's going to be prednisolone for horses. These things do have an expiration date. Usually anything that comes in an amber vial is probably going to need to be protected from light. So drawing up a dose and then just keeping it there, I would probably not be too comfortable using it later for an injection, okay? Short term, sure. Long term, probably not. The advantage of things like dexamethasone is that you can always take the injectable portion, and if push comes to shove, you can just shoot it in their mouth, and they can take it orally. You will still have a good effect, okay? So if you know that you have a horse that may suffer from situations like this where they will have hives, and that's usually when you're going to end up using it, then I would take dexamethasone. Other than that, I would likely not use it, okay? Things you may want to have, and even as a group, it's not a bad idea as a horse owner to have either Banamine or Bute, Previcox. There are different options. These are all going to be anti-inflammatories. Bute works really, really well orally. It works fantastic. It's probably going to be one of your least expensive. It's a little harsh on the kidneys. It's pretty harsh on the gut. So short term, yes, you can use it, and you can get away with the dose. And there have been studies, obviously more horror stories than studies, where you can actually give a dose of Bute to a horse, and it will actually still be able to stand on a broken leg. That's obviously not what you're looking for, but definitely that is the potency of Bute. Okay? Don't take it as humans. Do not take it as humans. It will kill your kidneys and it will kill your guts. Okay? Banamine is also a very nice one to have, and again, you don't have to get the injectable form. You're dealing with an emergency, giving the oral form, it takes longer to kick in, but it absolutely works, okay? So having some sort of anti-inflammatory when you're traveling with a horse is not a bad idea. You end up having a horse that colics while you're out in the mountains camping. You end up having a horse that has some sort of an injury, a stone bruise, you have a wound, you have some sort of an eye-related issue. Banamine works really, really nicely, okay? That is one of those drugs that I would seriously recommend, even if it expires on you. If it expires on you, you have to take that as a good thing. It means that you didn't have to use it. But usually if you get a tube of Banamine, it has 3 full standard size horse doses in it, and that should be able to be enough to get you to wherever you need to go to have whatever problem addressed, okay? So always see another good one to have. That one you should probably also protect from temperature, light, all sorts of other things, just to make sure that it's something available. Other things that work really, really great, and again, cheap and dirty, go to the drugstore, pick up some saline flush, and you can use that for eyes, you can use that for ears, you can use that for wounds. So a little container like this that you can squeeze works great. With eye emergencies, which is one of the next topics that we also end up discussing here, eye emergencies are horrible. Absolutely horrible, because you see something and the eye is just gushing and bleeding and this horse is tossing its head all over the place, and if nothing else, it just looks bad, okay? Split eyelids, and everybody's seeing that, and you got the pieces flapping on either side, and it just looks nasty, right? And then you've got the horse weeping, and you can't even get close to that eye, because that horse is just, no matter how high that head goes, it's always going to be taller than you. You can be the tallest person in the world, they can always raise their head higher than you. It looks bad, it looks horrible, but realistically, 9 times out of 10, out of all the emergencies you're going to be dealing with, lacerations like lids and things on the face, those heal fairly well, okay? So in a situation like that, eye flush works great if you can get away with it. If you can squirt something and just kind of dab around, works fantastic, okay? Most of the time you can get those seen. Within 12 to 24 hours, you're probably still going to be okay. That's where your dose of Banamine comes in. Let's give this horse some Banamine. Let's see if we can get some of the swelling to come down. And let's see if we can take this horse to be seen by a veterinarian somewhere. Things that you might wish to pack in a situation like that is a fly mask. Easy enough to pick up. Have a new one. Just have a clean one. If push comes to shove and your horse is not used to using a fly mask, you can obviously cut out the side of the good eye and then just leave the bad eye covered, and that'll protect it. If you're dealing in a time of the year where we've got a lot of flies love all sorts of wet, oozy, goofy stuff, they're just going to go to town on that eye. So if you have a fly mask, that'll protect that horse against the flies and give you a chance to go wherever you need to go to get it addressed, okay? Eye emergencies, anything that's a swollen eye, swollen shut, anything that's a squinty eye where you cannot actually physically see the eyes, I would not sit on that for more than 12 to 24 hours. And again, it's going to depend. Midnight, you're up in the mountains and you don't have a chance to get that horse to somebody to be seen till the next day, you're going to have to just deal with it, okay? You give him some Banamine, put on a face mask, try to clean it as best you can, and then take that horse whenever you can get it there, okay? But don't sit on it for 2 or 3 days and decide it's an emergency then, because then it really will be a situation where you could end up potentially losing vision from that eye, okay? So those are going to be the eye emergencies. Usually, again, out of all the emergencies you're going to deal with, the ones that look the worst, but unless that eye is just kind of dangling around, and usually if it's already hanging from the optic nerve, you're not going to pop it back in. You're just not. That eye is toast. Okay, so it's going to be somebody that removes it and takes it on, all that. So for the most part, big gushers, ugly deals, but they're going to be okay. Now we've all watched the movies and we've all seen, some episode either on, Chicago Fire or one of these, whatever episode, and then you got somebody who's got some sort of a stick and they're protruding and it comes in this way and it comes out the other way. And walking around and trying to figure out, let's pull it. And everyone says, no, don't pull it. And you say, yes, let's pull it. And then you call in the super duper whoever's dealing with it, and they kind of cut those edges and wounds and pack it all up and try to bandage it. That's a great opportunity. That's not something that we always have available. There are certain cases where you want to try to do that as much as possible. Okay, if you are in the vicinity and what you're doing is from here, you're going to some sort of place where you can take that horse and you can load it, and you've got, for example, a branch sticking through the armpit, if you can cut that branch and just tuck it, go, okay? Don't sit there and mess around and pull the branch and somebody else is poking from the other side and the horse is trying to flip over on you, and it's turning into a nightmare. You're going to create more of a problem than what it's worth, okay? Those are situations where that horse is likely going to be sedated, cleaned out, etc. And if you pull something that's potentially stopping a bleeder, like they tell you in all the movies, you could have a horse gusher, okay? Other situations, likely you're just looking at the evidence. You've got that chunk of muscle that's just kind of splayed out. You've got tatters of skin on this end, tatters of skin on the other side. Horse is snorting and blowing and dry blood. You see all of the evidence and you don't really know what all happened there. You just think, oh, wow. Ew. Yuck. Those situations are a little different. You're already dealing with the aftermath, so you try to clean it up as much as possible. Anything that are legs, you can get away with wrapping, okay? Even if all you have is a hose or a bucket and all you can do is just wash it, try to wash it as much as possible. There's a saying in veterinary medicine that the solution to pollution is dilution, okay? So if you've got a whole bunch of dirt and crud and gravel and blood and snot and all sorts of other stuff in that wound, if you can hose it off and clean it off and then wrap it, you're going to be doing pretty well, okay? And then load that horse up and off you go. If you're going to be dealing something that's going to be more of the torso, the chest, the, kind of up by the gluteal muscles, the back, those tend to be really hard spots to bandage. Don't even try bandaging. Anything that's going to be elbows and shoulders, you can't even put a bandage on. You're going to spend more time putting it on than that horse going and the whole bandage just lands on it, okay? But those respond really, really well, again, to just hosing, soap and water, Vaseline. Those are going to be good approaches, okay? And then at that point, you're probably going to need to get that horse started on antibiotics. But again, starting the horse on antibiotics 12 hours later, 24 hours later is not going to be a huge deal. Some people do like to carry antibiotics in their first aid kit. It's not a bad idea, but again, if it's going to be something that expires, you have to kind of make that judgment call. You want to carry one dose and you don't want to carry others. Again, sulfas, that's one of the ones that we typically use for horses. It's an oral antibiotic. If you're going to give sulfas, you better have some form of giving it. So a dosing syringe is going to be something that's necessary. And you better make sure that the person who's holding that dosing syringe and mixing up those medications is not somebody who's highly allergic to sulfa. Because, yes, congratulations, you just saved your horse and you killed your best friend, okay? So definitely take that with a grain of salt, clean it, deal with the emergency, but if you can't get that horse started on antibiotics, go ahead and get antibiotics the next day, okay? As much as you can clean it, that's going to be your best approach. Wounds that come along the torso, sometimes we've got huge gaping wounds and we think, oh my gosh, if we don't end up suturing this horse is never going to make it. If it's muscle in horses has a tendency to heal fairly well, okay? Our main sources that are going to be highly susceptible to infection, high risk, are going to be anytime you have bone exposed or anytime you have joint exposed, okay? Those are going to be the two big ones that we end up dealing with. Anything that's going to be skin, anything that's going to be muscle, usually that tends to come back fairly well, okay? Sometimes, you end up with some sort of a scar or something, but those tend to heal, even if you're applying some sort of care to them hours after whatever ended up happening happens, you're going to be okay. When you're dealing with joint, when you're dealing with bone, those are going to be the ones that can end up being more problematic, okay? So again, we said anything that's going to be legs where you don't have a lot of muscle and you don't have a lot of skin that's covering, those are going to be the ones that you're going to want to put some sort of wrap on to protect these animals. And we'll be practicing on a horse that allows herself to be wrapped so you guys can see just how you apply some sort of a leg wrap. Okay? Any questions so far?
I have a question.
Yes, ma'am.
On Benamine, how much expiration do you allow?
On the oral stuff? In my opinion, it depends on how it's being kept. Some people will keep their Banamine in a refrigerator, which I think is great. Or you can do some sort of temperature control. So if you're keeping it, I'd say in a metallic trailer in the back and it's going to get stinking hot, you're getting up to 180 degrees and then you're going down to freezing, and that Banamine's been sitting there weathering those changes, I would probably say you're not going to have a very long expiration date. Okay? But again, orally, it might not work as well. It's not that it won't work, but it might not work as well. Okay, so that 1,000-pound dose that you gave your standard size horse might not cut it the way a 1,000-pound dose would cut it on a fresh, tube of Banamine. Okay, so if it's oral and I've got it and I've got nothing else, I will still reach for it. If I have an option and it's something that's not expired, that's obviously going to be my best approach. Okay, so definitely temperature control is going to play a huge role in how long it's going to last you. Okay,
Thank you.
Always check expiration dates, especially on anything that you're going to be giving orally. Injectable, those are going to be the big ones that you want to check. Again, oral versus injectable. I hesitate to give something injectable. And part of that is because when they write that expiration date, they're also certifying a level of purity and sterility in that product. And so if it's beyond that stage, that little rubber stopper might be disintegrating, it might not be holding as well, it might, be a little more porous, and so you might not have the same substances, and you don't want to, in the attempt to do something good for your horse, you're actually doing something worse for your horse. Yes, sir.
The uptake of injectable Banamine given orally, is it faster than paste Banamine?
It is, however, it tastes absolutely horrible. This is the horse of experience because it's landed in my mouth. It will burn your mouth. And so, again, if you have a horse that's a little persnickety about taking oral stuff, you will never get a dewormer in there. You will never get an oral dose of Banamine. You will never get any form of bribery in there once you give that shot. So if you don't have another option, absolutely, you can use it. If you can mix it with something else to kind of dull the flavor a little bit, that's another option. But it's very, very bitter, and it does have a tendency to kind of burn that tongue. Okay, so it works, but again, I would hopefully use something that's going to be an oral paste. As far as loading that horse onto the trailer, first of all, we said, okay, let's make sure that it's not an emergency the first time that we load it. Second thing that we want to say is you want to make sure that you have halter and lead rope that fit your horse, obviously. It might be a good idea to have a couple of additional ropes. And the reason for these ropes is in the event that you have an issue with your trailer and you have to load this horse onto a different trailer and this horse is not familiar, occasionally you can put a rope across the back and have somebody help load the horse from the back. Okay? You don't want to be the person pulling. The moment you start pulling on that lead rope, that horse is going to do what? What do all horses do? You're pulling on me, I'm going to end up backing up, right? So don't duke it out with your horse. Question as to whether you load the horse. If you're dealing with multiple horses and you've got one trailer and you've got a suspicion that horse might end up going down, do you load it towards the back or do you load it towards the front? And that's always going to be a little bit of a judgment call. Here's the deal. You want to load it where that horse, if you can, just freeload and not tie it anywhere, that's going to be your best option. Because if that horse goes down, it can end up hanging itself either from its halter, it can end up getting so tight that you can't get in there. And if it's wedged, you're not going to be able to open that slant, you're not going to be able to open gates, you're not going to be able to open doors. And second of all, if that horse goes down for any reason, you want to be able to pull it out the best way possible. Okay, and you kind of have to assume that at some point, we hope not, but should that horse either faint or die or whatever the case, you might end up pulling legs, okay? So if you have a horse that's hung up by its head, that's going to be a very hard scenario to end up dealing with. And if this horse absolutely needs to lie down or go down, you would rather be down so that you can end up pulling it out versus having a horse that's hung on its head. If you're dealing with more horses and there's no option for you guys to put these other horses in a different trailer that all have to travel together because that's the one trailer you have, and you think this horse is going to go down and there's enough space to put that horse towards the back, put the horse towards the back. Yes, you can't keep an eye on it. But if that horse goes down, you can unload everybody so that you can get to that horse. Does that make sense? Whereas if you're dealing with the opposite and this horse goes down, now you have to keep everybody loaded in the trailer until you get this horse unloaded so that you can move it. Okay? So it's going to be a little bit of a judgment call as much as possible. Give that horse as much ample space as you can if it's a horse that tolerates that. Some people will say, with fractured legs, you want to keep this horse contained. I would still not contain it. Okay? You're going to be hitting bumpy roads. You're going to have a horse that may end up going down, a horse that's suffering some sort of a blood loss and will end up fainting on you. I would rather that horse have as much space and my being able to get to it than the opposite, where, now I've got a horse that's contained, but because he's wedging against whatever latch I've got, I can't get it open and nobody else can get it open and somebody's going to end up getting hurt. Okay? So you have to be a little conscientious about that and you have to be cautious about that. If you're loading in a 2-horse and there's no other option for it, you go with what you've got. Okay? Always, always, always be very careful as far as you don't want a person to get injured. And I've seen way too many shoulders that have been wrenched from their sockets because the horse either tries to flip or somebody tries to pull or you've got opposite directions. So as much as possible before you even open that trailer, check to see what position that horse is in before you get in and start working with what you're doing. Sedation, plus or minus. Some people like to carry sedation. We now have dormosedin, which is an oral sedation that works really, really nicely. The idea is that you don't want that horse to swallow the sedative. You want to just smear it along the gums, inside the cheeks, under the tongue, and it's supposed to absorb. It takes 44 minutes, and I kid you not, it is 44 minutes from when you give it to when it actually kicks in. It is going to be the 44 longest minutes of your life, okay? First. Second of all, it's not going to work if somebody gives the sedation and somebody else is petting the horse. There's a lot of noise going on. There's too much stimulation. That horse is not going to get quiet on you, and it's not going to sedate, okay? The horse is going to be riled up from whatever happened. It got injured, it got bitten. You know, we've got sometimes dog bites that end up happening on the road. Something came after them. Those horses are not going to get quiet, okay? Why? Because there's too much stimulation going on. They've got all those, you know, every single panic button pushed on them. So trying to give them a dose of sedation, you're likely going to have to give them too much sedation to get them to a point where they're able to respond, okay? So again, it's a little bit of a double-edged sword, whether you take sedation or not. Again, you don't want it to be the first time that you sedate a horse. It's going to be in the event of emergency if you don't know how this horse is going to respond. And some of them do, you know, faint. Some of them fall. Some of them end up getting too woozy on you, and then you don't have 4 legs on the ground. And if you've already got a horse that's picking up 1 leg and suddenly it's sedated, well, picks up 2 legs, we know what's going to happen. Horses were not meant to stand on 2 legs. Okay? So again, hit or miss as to whether you take that one, and I know that I'm being very waffly with some of these things because many of them are just going to be judgment calls. I'm not going to be there in the event of an emergency standing with you and say, okay, this is what you need to do. So if you've got cell reception, you've got a veterinarian that you trust, good idea to call to get you back into wherever you need to go. But in the event that that doesn't happen, you have to use common sense and what you know about this horse that you're dealing with. And this is going to be probably the most difficult one that any of you will deal with. Having to put a horse down. It's horrible. I'm a veterinarian. I've been a seasoned veterinarian for I don't know how many years. I cannot put my own animals down. There is a huge psychological component to putting animals down. We think that we're going to be able to do it. It's not as easy as we think. Okay? There are ways that it can be done safely, and unfortunately I'm going to show on Aspen where it is that you would put that shot. But you don't want to do it, again, you don't want it to be the first time that you've ever fired a gun. You need to be aware of firearm safety. If you are not aware of firearm safety, again, in the event that you're trying to put a horse down and that bullet ricochets, you didn't realize that there was somebody standing close by, and now you don't have 1 emergency, you have 2 emergencies, and now you have to decide, okay, so don't be that person. Make sure that you're aware of how to use guns. Make sure you're comfortable to use guns. If you are not, don't do it. Okay? Just don't do it. Find somebody who will. Reasons why you would euthanize a horse. They're not really that many. The ones that I can think of off the top of my head would be you've got some sort of a penetrating injury, and now you've got organs and guts sticking out. You're not going to save that one. If they're tripping on their guts and intestines, I'm sorry to be so blunt about it, that horse is not going to be saved. There is no way that you can take that anywhere and somebody's going to be able to do anything with that. If you've just got a little hole that's kind of poking out and nothing's coming out, belly band it, there's your trusty duct tape, and stick it in the trailer and off you go. But if it's something where you've got open splayed gut sticking out, that's not going anywhere, okay? That's going to be your first one. Your second one is going to be broken limbs, okay? Anything that you've got that leg is absolutely dangling, and we're talking dangling probably from the hide, you're not going to be able to go anywhere with it, okay? If you've got a little bit sticking out, or you've got something that you're not sure if it's fractured or not, but it's not swaying in the wind, that's going to be a possibility to tape it up, bandage it, load it up and go, okay? Some people will use all sorts of different things, like a broomstick to try to stabilize it. I usually have a tendency to believe that those things get a little more convoluted than that if you don't know where you're placing the broomstick, and suddenly this horse has a broomstick sticking in the wrong end, and you forgot whether it goes on the outside or on the inside, and then we've got, now you're taking it with a penetrating injury as well as whatever else is going on, okay? So realistically, try to bandage it. Horses can be on 3 legs, they will load on 3 legs, they will stand on 3 legs, and they can make it to the vet on 3 legs, okay? So if you're not 100% sure, you would go ahead and just see if you can load it up and get it on. And if nothing else, if it goes inside the trailer and it needs to be put down inside the trailer, then that's what's going to end up happening, okay? But at least that animal's contained. Other than that, there really are no other reasons. Violent colics, That might be a reason. Again, if it's an animal that's already in shock and down and staying put, those are gonna be the ones that you could potentially end up putting down relatively safely. If it's something where you're choosing to fight a moving target, that's gonna be a lot harder, and you really, really need to be aware of the people around you. So realistically, anything that's gonna be intestines flopping out, anything that's gonna be broken bones, serious broken bones that anybody can see that that bone is sticking out in the wrong direction, or potentially a bad situation where you've got a horse that's already in shock and colicky. And number one rule, if you put a horse down, what do you have to make sure you do? Make sure it's dead. Okay, absolutely make sure it's dead. This is gonna be that typical non-adhesive bandage. You can pick these up at any sort of a supermarket, drugstore, whatever. You can use the human form. They work absolutely great. Smear a little bit of Vaseline on that and slap that on any sort of a wound, and so it works great. Same thing if you're dealing with something smaller, this type of roll cotton that you can also get works fantastic. So there's a lot of supplies that you can use that are human supplies that might be easier for you to get a hold of, okay? Don't let me forget to give you that. This is the vet wrap. Vet wrap works really, really well. This is gonna be more for a small animal version, but it works great. You're just gonna go through a lot more of it. So this is gonna be, the 4-inch one is gonna be what you typically end up using for horses, and it works great. Have a couple of these on hand. It can be name brand, it can be cheapo variety. These work fine no matter what, okay? Something else that you might end up using that works really, really well, these little pee pads or diaper pads that you can end up using, they work fantastic. You know, you can cut it, slap it with the cotton side towards the wound, and you can use that to wrap. Now this is something that you can always use. Ace bandages work absolutely great. I would likely get some of the taller ones again, because this is going to be more for a small animal than it is for a horse size, but they work absolutely fantastic. I don't typically end up using the little butterfly clips. I'll just tape it, and again, we spoke about the fact that duct tape saves lives. That is going to be one of those scenarios where you can duct tape an ace bandage on. You want to make sure it's not too tight. And then last but not least, this is something that most women think is fantastic. Most men are absolutely mortified, but those women's hygiene pads, they work great, guys. Hate to say it, if you don't want to go buy it, see if you can get somebody to buy them. They work absolutely fantastic. There's a reason. They're very absorbent, they're clean, they're sterile. Slap that puppy on there. You've even got the little adhesive and the wings and all this other stuff that most men don't even want to know about, but it works absolutely great for a wound, and it will absorb quite nicely. Most of us would tend to think that if we were going to give a shot, most of us would tend to think you go between the eyes, not on the horse. If you go between the eyes, you're going to hit sinus. It's going to be a gusher, it's going to be a bleeder, but you still have a horse that's alive. Okay? So general rule, inside of the ear to outside of the eye. Form a line. Okay? Inside of the ear to outside of the line. Where these two intersect is actually going to be a lot higher than we would normally think. Okay? So you're going to end up going probably right around here with that shot. Okay? If you go this far down, you're going to have to pepper that horse with bullets to try to get it dead. And it's not a pretty scenario. You want to have one clean shot and be done. Trust me, psychologically, it's hard for people to watch, it's hard for people to do, so you definitely don't want to miss your spot, okay? This, again, was one of the reasons why I was telling you, if push comes to shove, you can put a little piece of tape there. You know, just make your incision as you would have it, make your little X, and right where the two intersect, that's where you're going to end up going. Or you can use, if you've got a blaze or something, you can put a little Sharpie point right there, okay? Better to have it documented, know where you're going, and aim for that spot than not. Okay? So it is going to be higher than you would normally think. Do not go between the eyes. You will not kill that horse. When you're dealing with any sort of a roll, you want to make sure that you've got one end towards you and the end, maybe here. So I think all of you can end up seeing. What I would recommend is that you go from the inside out. And then you're going to end up doing about 3/4. Half to 3/4 of where your previous one was, so that you end up having a little bit of overlap. Again, you're not going to end up having it too tight in a situation like this. So I put all my bandage, my supplies, my whatever I'm covering, my roll cottons, and then I'm just going to end up bandaging. And then I'll come up. And then ideally this should have been the other way around, but that's okay. Okay? So that's what I'm going to wrap. What I want to make sure when I'm wrapping a leg is that I've got my entire surface area covered. It's not going to be too tight. You don't need to go tight. You should be able to do the finger test, okay? Finger test means I have to wedge a little bit, but I can get a finger in there, okay? That way I know that it's going to be comfortable. I'm not going to cause any major issues, and this is going to be about as tight as I need something to go, especially if I'm dealing with a wound, okay? Bear in mind this horse is probably going to be messing around a little bit, and so it's always a little bit more of a catch situation, but this is what you're going to want to do. If you end up doing a multiple wrap one, we decide we're going to put a flat wrap on that. General rule, I will do from inside out and keep it going that same direction.
Sometimes she'll think you want her to bow when she does it.
What I don't want to do is do the first one inside out and then flip around and do the other one outside in. Don't want to do that, okay? You're going to end up torquing the way that that pressure goes. So you always want to stick to the same direction that you're going. And you always want to end up, it's easier for me, I don't hold the bandage away. It's easier if you roll it towards the horse on the horse, right? And I'm going to cut down on a whole bunch of little wrinkles and stuff like that. Those wrinkles may seem unimportant, but if you guys ever end up putting any sort of a bandage on you and you have one little wrinkle, after a while it drives you nuts. That's exactly what ends up happening here, okay? So you don't want to have pressure points. Next thing, it's really, really hard. This is probably the easiest location to end up putting a wrap on, okay? Lower limbs are going to be fairly easy if push comes to shove, and I think that this is going to end up creeping up. Again, trusty duct tape, I can put it on the bottom of this to hold it in place. If I'm going to wrap something up here, I can't just get away with wrapping something up here. What's going to happen as she starts to walk?
Slips down.
Correct. So, by default, wrap the bottom joint too. Okay? Now you've just created a column. Okay? And that will hold the same thing in place. You can put a piece of tape across the top or not. Still want to have the same test. I can put a finger in there, it's going to be fine. If I'm going to have a wrap on for longer periods of time, I have to make a little cut right here. What happens if you leave a wrap over a joint that moves a lot? What do you have the potential of having?
Flexion and friction and
Correct. So friction, and then you end up having sores, right? So you don't want to have bandage sores. So if it's going to stay on for longer periods of time, this is just the way you're going to be traveling to take it from point A to point B, you're fine. Okay? But if it's going to stay on for longer periods of time, you need to make a little cut in the bandage right here. And it doesn't have to be a big cut, but the reason is when that horse flexes and extends, then that allows no sores to take place over that joint.
Are you talking vertical or horizontal on this cut?
Usually I'll just go ahead and make it, I'm just going to go ahead and make it a vertical cut. Occasionally, I'll kind of do, like the old professor sweaters that have the patches on it, and then I'll just take out like a little patch right here. Okay? So this is going to typically be the one that you're going to have to do that to. Nothing else here is going to be a high motion joint. Okay? That's going to be your basics. That's going to be what you're dealing with. When you're dealing with anything that's related to the eyes, work your way. Obviously, her head could go very high, but if I'm going to be squirting anything in there, I can squirt from the side, or I can squirt from the front. Usually from the side, I might have better luck. Okay? Pop that eyelid, squirt. Granted, not everybody's aspirin. Anytime you're working, if I'm working on this leg, likely, if I had an injury, I would have Nancy on my same side. Okay, it's going to be on the off side of the horse, but we want to be on the same side in case this horse decides to move some direction. We're both going to be going the same direction. Not the case when we're working on faces. If I have Nancy on the same side, then suddenly it's too crowded here, right? So I may have her on this side, where she can still see me while I'm working on this side of the horse. Okay? Same thing with back legs. You work your way. You can probably get as far, you're not going to get into a stifle joint, but if you're going to end up dealing with a bandage, same thing. You want to make sure that you've got space for this to come out. Any questions? No? Guys, thank you so much.
thank you.